In the path forward, a member of the White House coronavirus task force sharing his concern with Fox 17 News today about our state's spike in cases.
Tennessee is among the top states in new cases, and you're still increasing, which is a concern, even of the data I have this morning.
Another issue for Tennessee's is our hospital capacity. As Fox 17 News' Harriet Wallace shows us, one local doctor says something has to be done right away because he is being forced to turn away seriously ill patients.
And things could likely get worse as Tennessee recording its highest daily case count since the start of the pandemic. That's according to the state health department. And Sumner Regional's Dr. James Parnell taking to Twitter today saying with numbers like that, hospitals may not be able to help at all because they'll be so overwhelmed. So he's urging, almost begging Governor Lee to do more. Dr. James Parnell is trained in disaster medicine, and every day he suits up for a fight that he says the state and hospitals are losing.
Something has to change. We've got to try to reverse this.
The head of emergency care at Sumner Regional says the daily COVID cases are so out of control that beds at Nashville hospitals are running out, forcing critical patients, those with and without COVID-19, to go home and suffer or go to a Kentucky hospital. In a desperate move, he posted these tweets addressed to Governor Lee saying, quote, "Please help us. It's not just patients suffering," and quote, "Please enact a statewide mask mandate." He says Governor Lee has not responded to any of his calls for help, but the White House responded to Fox 17 News' request today.
All these people are not getting the care that they need because we're overwhelming the system, or there are certain lockdowns where people can't go.
Admiral Brett Goroir from the White House Coronavirus Task Force talking with Fox 17 News today about Tennessee's spike. Now, Fox 17 News, as you all know, has reached out to Governor Lee multiple times since the start of the pandemic, asking why he's not following White House guidance, but either got no response or heard the governor in press conferences standing by his pandemic approach. So we asked the White House about it.
Hundreds of thousands of our fellow Americans have died. Millions have been sickened. This is not a hoax. It's a real virus.
Governor Lee and other state lawmakers asking everyone just hold on for right now that we've got the vaccine here in Tennessee and starting to be administered. But everybody, the White House told Fox 17 News today that as far as the general population, we may not see most folks vaccinated until June.
A record-breaking day in Tennessee. A single-day coronavirus cases reach an all-time high.
In the last 24 hours, more than 11,000 of our neighbors contracted COVID-19 and another 53 of them died.
As cases break records, we see a historic day in the fight against COVID-19. Tennessee's first dose of Pfizer's vaccine given to a Nashville cancer surgeon.
Clinical Research Associates in Midtown, which administered this shot, has been running trials on this drug since August. Fox 17 News' Nikki Jenowitz spoke with the local surgeon who got that first shot. She's now live in Midtown with his message to people who may be reluctant to take this vaccine.
Yes, Dr. William Polk told me today that he was feeling good after getting his first dose of the vaccine, experiencing no side effects at all. And he really hopes that moving forward, people who might be reluctant to get the vaccine will see that and perhaps feel more comfortable getting vaccinated as well.
I just think it's amazing, the technology.
The beginning of the end. That is what Nashville surgeon Dr. William Polk is hoping this moment will mean in Tennessee's arduous fight against COVID-19. A symbol we may finally be turning the corner, a day after the state's outbreak was deemed the worst in the entire country.
On sort of a bigger level, I think that just a kind of a hope that with the vaccine that we actually turn the corner from the perspective of, you know, what it's done to so many businesses and so many people's lives, and so many people have been affected.
The 62-year-old had been a member of the placebo group in Clinical Research Associates' early trials of the vaccine, ongoing since August, involving more than 300 people locally. Polk says witnessing that research firsthand has informed his confidence in the vaccine.
I don't know a single physician that is not anxiously awaiting their turn in line to get the vaccine.
And Polk is certain it will be effective. But to those more reluctant, he sends the following message.
I think that the bottom line is the risk of the vaccine, a little bit of discomfort, maybe a fever, that pales in comparison to the devastating effect that it can have on a real significant proportion of people that get the virus.
And Dr. Polk will be monitored in the days and weeks ahead for side effects, symptoms like headache, fever, or on-site soreness. And he says he actually hopes that he does experience some symptoms because he says that means that his system is building up immunity to the virus. And he will receive his second and final dose of the vaccine here in 3 weeks.
New tonight, a group of Tennessee doctors say they have to speak up now as new numbers show our state is now the worst in the nation at containing the spread of this virus. Tennessee, #1 in new COVID-19 cases per million residents per day. Fox 17 News' Alex Apple now live in West Nashville to explain why the state government put its first shipment of this vaccine in storage instead of going ahead and giving it to the frontline workers.
Right, that's what you would have expected. Maybe it goes to the hospital workers here at St. Thomas. It was about 987 doses, and it all went into storage. And now the state is not even the first one to hand out a vaccine in Tennessee. Rather, a private company today beat them to the punch.
There is no other place in the world with a higher number of COVID cases per capita than Tennessee. That made infectious disease Dr. Isaac Thompson's job easy as he sought to describe the current state of affairs.
It's unfortunately very easy to summarize the current situation in the pandemic right now because it's by far the worst that it has been since the pandemic began. Every aspect, every metric is the worst since the COVID-19 pandemic began. And we have utterly and completely failed to contain this virus.
Yes, vaccines are on the way, but it will be months until enough of the population is vaccinated for COVID to exist only in our memories. The result is a dangerous time ahead for a state with no mask mandate or restrictions at all on business.
We ask you, sir, to make the Tennessee Pledge stronger by requiring employers to implement it.
Dr. Jason Martin says statistics mask something the governor must understand.
While these numbers tell a story, they're incredibly sad. They also sound a little sterile. They don't begin to describe the epic human toll that is being paid every day by patients and healthcare workers across the state.
The state's health commissioner put out a short statement after stashing the first rounds of vaccines away, saying her department is in, quote, constant contact with hospitals to prepare administration for our frontline healthcare workers and long-term facility residents and staff who choose to receive it. Dr. Laura Lyons, who works in emergency medicine, says hospitals are not too far away from having to make some heartbreaking decisions.
I hope we never reach a point where we have to start making decisions that truly we've never had to make before, in terms of who has the best chance of surviving.
Tomorrow morning, we'll have coverage of Governor Lee at Vanderbilt University Medical Center as they get their first vaccines, but the first supply statewide is certainly limited. The biggest effect that it will have will be on our doctors and nurses and making sure that the front line isn't decimated by them getting sick themselves and helping nursing homes out as well.
Thank you, Nikki. The White House Coronavirus Task Force says the rollout of the vaccine gives all Americans finally a finish line, they say, of June for this pandemic. With Pfizer's vaccine in circulation, Moderna's version set to roll out tomorrow, Admiral Brett Goroir, who heads up testing on the task force, tells me by the end of December, 20 million Americans will have already gotten vaccinated, but it will take at least until March to get those priority populations vaccinated to free up shots for everybody else.
And is there anything we could do to speed that up so that we can get herd immunity faster?
So we know that we will have enough vaccine administered to everyone who wants it in America by June. So we know that by June this is all going to be done. But I think the springtime is really probably the right time that most of your viewers are going to really be thinking about being vaccinated.
Admiral Goroir is urging all of us to commit to a few more months of hard work, masking, and social distancing, calling it the most caring thing you could do for your neighbor.